Medical Association. Dr. Kassam, will you be speaking?
Yes, I will.
Okay. Welcome to the committee. You have the floor for the next 5 minutes, sir.
Well, good afternoon and bon après-midi. My name is Dr. Adam Kassam, President of the Ontario Medical Association, and I am joined by Dr. James Wright, Chief of the OMA's Economics Policy and Research Department. On behalf of Ontario's 43,000 physicians, residents, and medical students, we appreciate the opportunity to provide a physician perspective on arguably the greatest immediate risk to the viability of healthcare in Canada, which is to say burnout of healthcare professionals. Physician burnout is primarily caused by stressors in the workplace, including inefficient work processes and environments and clerical burden. In other words, the inefficiencies and obstacles in the healthcare system not caring for patients are the major contributors to burnout. In fact, the OMA established a burnout task force in 2019. Its objectives were to serve physicians, residents, and medical students to understand the extent of burnout and then to identify specific solutions. In March of 2020, prior to the pandemic, a shocking 29% of Ontario physicians reported high levels of burnout, while another 2/3 reported some level of burnout. By March of 2021, of course, 1 year into the pandemic, that number was even higher, with 35% reporting high levels of burnout and almost 3/4 reporting some level of burnout. Ontario physicians face years of working above capacity just to clear the pandemic backlog of more than 21 million delayed medical services, let alone reducing the wait times that have plagued the system for decades. Attempting to achieve this within the existing system will only lead to more burnout. Physicians are incredibly dedicated to their patients. However, at some point, the stress is untenable, leading some to retire prematurely, reducing their workloads, or even leaving medicine entirely. This loss of experienced and dedicated physicians will further exacerbate the situation for remaining doctors. Retention and recruitment of physicians is paramount, given 1 million Ontarians already don't have access to a family doctor. The lack of physicians is even more dire in Canada's north. Today, Northern Ontario is experiencing an acute shortage of at least 325 physicians, including family doctors, psychiatrists, anesthetists, and several subspecialists. Some communities are critically underserviced. The OMA's Burnout Task Force has identified the top 5 system-level actions required to reduce burnout and drive retention and recruitment. First, streamline and reduce required documentation and administrative work. Second, ensuring fair and equitable compensation for all work done. Third, increasing work-life balance by making organizational policy changes. Number 4, promote the seamless integration of digital health tools into physicians' workflows. And finally, providing institutional supports for physician wellness. These are all system issues. So we need to collectively and collaboratively rethink our healthcare system so that it doesn't contribute to burnout in the first place. In fact, in Ontario, we have developed a plan to solving our system challenges. OMA's Prescription for Ontario Doctors 5-Point Plan for Better Healthcare, released in October of 2021, so not that long ago, and available at betterhealthcare.ca, provides a roadmap of 87 recommendations under 5 key themes to achieve meaningful and sustainable improvements for the entire healthcare system in terms of access, equity, efficiency, and integration. As contained in our prescription, the OMA strongly supports the call by Canada's premiers to immediately increase the Canada Health Transfer from the current 22% to 35% of provincial territorial healthcare spending. And this will provide the provinces and territories with the resources necessary to make health system improvements within their respective jurisdictions. Ontario's doctors also recommend other immediate actions by the federal government to reduce burnout and increase retention and recruitment, including but not limited to the following. First, incent physicians to practice in the north by offering a federal tax relief of 15%. Number 2, fund Canada Health Infoway to develop application programming interfaces, or APIs, to link the electronic medical record systems used within each province. Linking them would allow for information to be exchanged amongst physicians, and a lack of interoperability now is one of the most common digital health factors associated with burnout. And finally, supporting the development of virtual care appropriateness guidance by the national level specialty societies, who would work together to review all procedures within their profession and determine which can appropriately be done virtually or in person. Supporting the development of such guidelines reduces decision fatigue for physicians and supports equitable, appropriate, and high-quality care across the country. A publicly funded and universally accessible healthcare system is a cornerstone of Canadian values. On behalf of all Ontario healthcare professionals, the OMA implores the federal government to provide the tools and resources required by the province to effect sustainable and meaningful change. If we don't fix the healthcare system, we'll never fix burnout. And physicians and other healthcare professionals are depending on you and certainly Canadians don't have time to wait. Thank you, merci beaucoup, and we're happy to answer your questions.
Thank you, Dr. Kassam. We're now